9 episodes ago, we opened with a woman sitting in a parked car, unable to make herself open 4 emails, wondering what was wrong with her. If you've watched this entire course, you now know exactly what to call that, why it happens, how it's properly diagnosed, and what actually helps. That's not a small thing. That's the difference between a life spent quietly blaming yourself and a life spent understanding yourself. So let's close this course the way we should, by taking the 10 myths that cause the most damage, the ones that delay diagnosis, that damage relationships, that keep people from getting help, and settling each one clearly, using everything we've built together. Myth 1. ADHD is just a hyperactive kid who can't sit still. Adults don't really have it. They just have bad habits. We dismantled this in episode 1. ADHD is a DSM-5-TR recognized neurodevelopmental condition with documented differences in brain networks governing attention and executive function, and longitudinal research shows a substantial majority of children with ADHD continue to experience clinically significant symptoms into adulthood, even as hyperactivity often becomes more internalized. Adult ADHD is not leftover childhood ADHD or a metaphor. It's the same underlying condition, often looking different on the surface than it did at age 8. Myth 2. If you relate to a few symptoms on a checklist or a viral video, you probably have ADHD. We addressed this directly in episode 2. Individual symptoms, forgetfulness, procrastination, restlessness, are near universal human experiences. Clinical ADHD requires a specific threshold, 5 or more symptoms in a category, present before age 12, across multiple settings, causing genuine functional impairment. Resonance with content is a reasonable invitation to seek evaluation. It is never by itself a diagnosis. Myth 3. If you weren't diagnosed as a kid, you can't have ADHD as an adult. Episode 3 dismantled this thoroughly. The DSM-5-TR requires symptoms present before age 12, not diagnosis before age 12. Historical bias toward hyperactive boys, sex-based presentation differences, high intelligence enabling years of compensation, and unequal childhood access to evaluation have all contributed to enormous numbers of adults, disproportionately women, being missed entirely as children. Myth 4. Anxiety and ADHD are basically the same thing, or if you're anxious, that rules out ADHD. Episode 4 showed why this is wrong in both directions. The two conditions produce overlapping surface symptoms, poor concentration, restlessness, through entirely different mechanisms. Inconsistent attention regulation versus excessive intrusive worry. They frequently coexist and can worsen each other. And distinguishing them requires careful clinical history, not assumption. Myth 5. There's a simple test, a brain scan, a blood test, a quiz, that can definitively diagnose ADHD. Episode 5 was explicit about this. As of current clinical practice, no standalone biological test diagnoses ADHD. Diagnosis rests on a thorough clinical evaluation, developmental history, validated rating scales, ideally collateral information, and careful differential diagnosis to rule out other explanations. Be skeptical of any claim otherwise. Myth 6. ADHD medication is basically the same as recreational drug use, and it's always addictive. Episode 6 gave this the nuanced treatment it deserves. Appropriately prescribed and monitored stimulant medication, taken as directed for diagnosed ADHD, occupies a fundamentally different risk category than illicit stimulant misuse. And in someone with genuine ADHD, these medications typically produce calm and clarity rather than euphoria. Real misuse risk exists and deserves honest discussion with your prescriber. But the blanket equivalence with recreational drug use misrepresents the actual clinical and pharmacological picture. Myth 7. Taking medication for ADHD is a shortcut, or it means you didn't build real discipline. We confronted this directly, and it's worth repeating clearly here. Nobody accuses a person wearing glasses of cheating at seeing. A DHD medication addresses a documented neurotransmitter regulation difference. It's treatment for a real physiological pattern, not an unfair advantage over some assumed neutral baseline. Myth 8. If medication works, you don't need therapy, coaching, or behavioral strategies, or if you use behavioral strategies well, you don't need medication. Episode 7 and Episode 6 together showed this is a false either-or. Current clinical guidance generally supports combined approaches for the most complete and durable improvement, and the right combination is genuinely individual. Some people do well with one pillar alone. Many benefit most from combining them. Myth 9. People with ADHD just need to try harder to get organized, and if generic productivity advice doesn't work for them, they're not really trying. Episode 8 dismantled this with real mechanism. External, visible, simplified systems designed around documented working memory and time perception differences aren't a workaround for insufficient effort. They're the appropriate accommodation for a real difference in how the brain processes and retains information in exactly the same category as a ramp for a wheelchair. Myth 10. ADHD is purely a deficit, a liability with nothing positive about it, and it ruins relationships and careers no matter what. Episode 9 gave this the honest, balanced treatment it deserves. Yes, unmanaged ADHD is associated with real documented challenges in relationships and careers, but it's also associated with genuine strengths in the right context. Creative and divergent thinking, strong performance in dynamic, high-stimulation environments, and resilience built from navigating a world not designed for this kind of brain. And crucially, diagnosis and appropriate treatment measurably improve outcomes in both relationships and careers. This isn't a fixed, hopeless trajectory. It's a highly modifiable one. Let's take a moment, because this is the last one, to pull the entire course together rather than just listing myths in isolation. Across 10 episodes, we built something deliberately, piece by piece. We started by establishing what ADHD actually is, a real DSM-5-TR recognized neurodevelopmental condition with 3 presentations, rooted in documented differences in attention regulation and executive function circuitry, not a character flaw. We looked honestly at how it's discussed online, genuinely valuable in normalizing hidden experiences, genuinely risky when checklists replace evaluation. We explored why so many adults are missed for decades: historical bias, sex differences, compensation, masking, comorbidity, and access. We drew a careful mechanism-based line between ADHD and anxiety, 2 conditions that look alike on the surface and operate completely differently underneath. We walked through what a real evaluation actually involves, so you'd never mistake a rushed diagnosis for a rigorous one. We gave medication an honest, complete treatment, mechanism, evidence, risks, and the questions people are usually too embarrassed to ask out loud. We covered the non-medication toolkit with the same rigor, grounding every strategy in the actual mechanism it addresses. We got concrete and practical with daily systems for space, time, and focus, and we zoomed out to relationships and career, where all of this either does or doesn't actually get lived out day to day. Here's the through line that's been quietly present in every single episode, whether we said it explicitly or not. ADHD is real, it's well documented, and understanding its actual mechanism, not vague impressions, not oversimplified social media content, not moralized judgments about effort and discipline, is what allows for accurate diagnosis, effective treatment, and frankly, self-compassion that's finally grounded in fact instead of decades of misplaced blame. If you're an adult who suspects you might have ADHD, the appropriate next step isn't to diagnose yourself based on this course or any video. It's to take what you've learned here and bring it, along with your own specific history and experience, to a qualified clinician for a real evaluation, using everything you now know from episode 5 to make sure that evaluation is a thorough one. If you're already diagnosed, I hope this course gave you a deeper, more precise understanding of your own condition than you had before. The actual mechanisms behind the medication you may be taking, the actual reasoning behind the strategies that do or don't work for you. And if you're a family member, a partner, a friend, or simply someone who wanted to understand this better, I hope you now carry something more useful than sympathy alone. Genuine, accurate understanding. That woman in the parked car from the very beginning of episode 1, unable to open 4 emails. She eventually did get an evaluation. She was diagnosed with combined presentation ADHD. She started treatment, a combination of medication and the kind of behavioral systems we covered in episode 8. It didn't erase her ADHD. It's not a cure, because ADHD isn't the kind of condition that gets cured. It's the kind of condition that gets understood and managed and worked with for the rest of a person's life. But she opened those emails, and then she opened the ones after that. Not because she suddenly became a different person, but because she finally understood, clearly and accurately, the brain she'd had all along. Thank you for completing this course.